Good afternoon. We're joining you today from Treaty 6 territory, and I'd also like to recognize the Métis people of Alberta who share a very deep connection with this land. I'm joined today by NDP health critic David Shepherd and by Laurie Sigurdsson, critic for seniors and housing and mental health and addictions. The most significant and pressing issue right now in Alberta is the health and safety of children, quite frankly, of all Albertans across this province. There are wait times approaching 20 hours at some children's hospitals. Many children are missing school because they are sick, and there is a severe shortage of the very medications that would bring them relief from this illness. Today's announcements does nothing to get Albertans a family doctor. It does nothing to address the specific calls from frontline paramedics to reduce ambulance wait times, and nothing to get children's medication into the hands of Alberta parents. Danielle Smith has absolutely no mandate to create the chaos, the cost, and the conflict that today's announcement may well generate. In fact, this new round of chaos Danielle Smith is inflicting on healthcare will likely make the situation worse. Healthcare workers deserve leadership that will listen to them and support them. Fundamentally, the current crisis in healthcare is driven by a shortage of frontline healthcare workers. This shortage has been growing worse and worse with each passing month as the UCP displays open hostility to Alberta's frontline healthcare professionals, as they have done almost since day one when they were first elected. Many of those folks many people have reached out to David, to Laurie, and to myself in recent days, talking about how low morale is under a government that shares dangerous misinformation and conspiracy theories, a government that accuses healthcare workers of manufacturing the staffing crisis, and a government that is fixated on experimenting with private for-profit healthcare at the expense of Albertans' access to our public hospitals. The dismissal of the AHS board today is nothing more than bad political theatre. Or, as Danielle Smith herself said when Alison Redford did the very same thing, it's window dressing. Window dressing at a time when Albertans and Alberta children are in significant danger. I want to speak directly to Albertans. An Alberta NDP government will go straight to the heart of the problem. We will bring real resources to the front line and reverse the years of UCP funding cuts. We will work collaboratively and respectfully with healthcare professionals, and we will launch the largest healthcare recruitment campaign in the history of our province. We will end the chaos and bring stability back to our healthcare system, back to our hospitals, our ambulances, and to primary care. We will ensure that you and your family can get the care that you need, when you need it, close to home. Thank you, and I'm happy to take your questions.
We'll go to questions on the phone. Just a reminder to press *9 if you're joining us on the phone, and use the raise hand function if you're joining us via Zoom. You can say your name and your outlet at the top. We'll go to our first question.
The Star today. Wondering what you think of the person who's been appointed as the official administrator, Dr. Cole.
Well, you know, I don't know that it really actually matters. I mean, what we're really seeing here is a rearrangement of the chairs on the deck of the Titanic. Maybe we've thrown a couple of the chairs off the deck, but what's not happening is no one is in the hold of this ship repairing the leaks and fixing the engines. And quite honestly, whether we have a board of AHS as a whole or John Cowell really doesn't matter. It's theater, but at the same time, what it does do is it creates a greater sense of uncertainty and instability within the overall organization. So, this government has created instability by firing their CEO. They've brought in an interim CEO, and now they've got an interim administrator, and there's a lot of interim stuff going on, but no one's actually focusing on the real problem.
Okay, speaking of this change today with the board being gone and bringing in an administrator, I got the impression they're talking about this taking at least 6 months. They'll say people will see results, measurable results. Of course, 6 months is when the next general election is scheduled for. Do you think that we will see measurable results in 6 months, or is this something that the government can point to whenever we discuss healthcare from now on? They can just point to Dr. Cowell and say it's under, there's plans to change things, and just wait to see the results.
I don't know what they will try, but here's what I know, is that it doesn't matter who's at the head of things, first of all. Secondly, the plans that were rolled out today are not plans. There was nothing of significance. It was simply restating the obvious, and that's layered on top of 3.5 years of failing to address the obvious. So there's nothing specific there. Moreover, they can refer to specific bureaucrats all they want. What we know is that we're hearing day in and day out from families who are in crisis. We're hearing from parents who are taking sick and feverish children into the ER and being told they have to wait hours and hours and hours before that child can receive care. So at the end of the day, because that kind of thing is happening, because ambulances are taking far too long to get to the scenes of accidents, because we have whole cities where no family doctors are taking new patients, those are real problems. And in the absence of acting in a meaningful way to start addressing these problems, this government will be held to account for their failures with respect to providing good health care for Alberta families.
We'll go to our next caller.
Hi, it's Lisa Johnson from the Edmonton Journal. I have kind of a speculative question. I mean, you said today's announcement offered nothing of significance. Most of the stuff Minister Copping was talking about, they were planning to do anyway. Some of the reforms with EMS, obviously with the surgical initiative, things they were planning to do or were already working on. So I guess my question is, if these are things that they were already working on, why do they need an administrator to do this? Do you think that there's something about these goals that the board stood in the way of, and why get rid of the board to do these things?
Really, there's nothing about the strategies, if you want to give them that much credit, that the UCP is talking about that a board would even have the mandate to get in the way of. So this is nothing more than political theater. We're being given political theater as opposed to healthcare solutions for Alberta families. And so there is really no reason for this. And moreover, the items that they claim they're working on are in many cases just exercises in restating the obvious without creating or proposing any kind of meaningful change in the way things are done to bring about different outcomes. They completely ignored the calls from many frontline healthcare providers who have offered up more substantive solutions. And so what this is just more of the same and a superficial change at the top to hope that Albertans can be fooled into thinking that help is on the way. But there is absolutely nothing about today's announcement that should convince a single solitary person that help is on the way. And quite the contrary, things are likely to get worse before they get better after the next election.
Any follow-up, Lisa?
Thank you.
And we'll go to our next caller.
Yeah, hi there. Adam Toy, Global News. Just it sounded like with today's announcement, a lot of it would be contingent on getting a lot more people in place in the system, nurses, doctors, EMS, etc. I'm wondering if, sir, I'm just wondering if you're anticipating that this government will actually do that, and if you think they'll be able to, given how the challenges that all healthcare systems across the country are facing.
Well, there's no question that the shortage of healthcare workers is not a new issue, and as that problem has grown across the country and across the world, the efforts that are going to have to be made to resolve that problem are greater and more complicated. That being said, we are dealing with a UCP government that declared war on healthcare providers almost as soon as they were elected, threatened to fire thousands of nurses, ripped up the contract that doctors had, told many important frontline healthcare providers that they needed to get ready to accept 10% wage cuts. So that kind of instability, layered on top of their constant efforts to privatize healthcare, is going to make things worse. Their private surgical initiative is actually going to make the shortage in frontline healthcare providers worse. So it is for sure a problem. The thing about today's announcement is all they did was describe the problem. Well, congratulations. The fact of the matter is that most Albertans have been very clear and already themselves, as a result of unfortunate experience, understood the problem. What we don't have here is a considered plan to fix the problem. All we have is a little bit of window dressing changes at the top with no plan to actually move forward with an ambitious recruitment strategy. An Alberta NDP government will embark upon the largest ever healthcare recruitment strategy that this province has ever seen.
Any follow-up, Adam?
No, thank you.
We'll do one more pass for questions. Star 9 if you're on the phone, and raise hand function if you're joining us via Zoom. And seeing none, that's all for today. Thank you.
Thank you. So much for watching, and to learn more, check out albertasfuture.ca.